Hello. Welcome to Virtua Health's Real Talk Women's Health Chat. I couldn't help dancing a little bit there. Such great music to kick us off tonight. I'm Bridget Reuter from the Virtua Health marketing team, and I'm here to get things started. It is wonderful to see so many of you joining us for this fantastic event. A quick reminder that your camera and microphone are disabled, but you can still interact with our panelists during the session in two ways. You can type questions into the Q&A tab at the bottom of your screen, and you do have the option to click anonymous before submitting. There will also be a couple of polling questions that will pop up during the session. Just click your answers on the screen. Now, many of you, when you registered, submitted some great questions for our experts. Several of those topics will be incorporated into the discussion. But if you have other questions, just type them into the Q&A tab. So let's get this discussion started. Menopause can be a mixed bag of little surprises, some hotter than others. From night sweats to the menopause belly to a decrease in libido, our experts will be diving into all of it. It is my pleasure to introduce our fabulous celebrity moderator, Madge the Vag from Scary Mommy. Her online series is followed by millions of women. It celebrates the workings of the female body with a mix of facts and humor. Now, if you're not familiar with Madge the Vag yet, make sure you follow her on Facebook and TikTok. You can also now get a personal message from Madge on Cameo. Now, if you're not familiar with Cameo, ask a millennial in your life. It's a good conversation starter. So let's get started. We are thrilled to have Madge back at our Real Talk Health Chat. She is joined by two Virtua Health experts to help us understand all about flashing through the menopause journey. Take it away, Madge.
Thank you, Bridget. And my goodness, hi everyone. I'm Madge, coming to you from Scary Mommy TV, and I'm so happy to be here today. What's up, everyone? So we're talking about menopause, and as women, our bodies go through so many changes during the menopause journey. I just grew like 3 body hairs and leaked a little. It never stops. So how do we know what to expect and how to treat our symptoms? The good thing is our experts are here tonight to give us the scoop about everything menopause. With that said, I'd like to introduce our Virtua Health gynecologists. We have Rachel Kramer and Colleen McCleary. Dr. Kramer is the medical director of women's health services at Virtua Health and has over 25 years of experience in obstetrics and gynecology. That's a lot of vagina in one lifetime. She is a triathlete and co-wrote a book on exercising and pregnancy called Going Beyond Labor and Delivery. I thought the labor and delivery was a triathlon. My goodness. Dr. McCleary has over 20 years of experience treating women with menopause symptoms like hot flashes, worsening memory, insomnia, and decreased sex drive. I am making an appointment right now with you. She was trained by the leader in bioidentical hormone replacement therapy and treats women and men at Exuberin by Virtua. That was a mouthful. I could barely get it out. My gosh, you two are rock stars. I'm so excited to be here with you. So I think we're ready to get started with our very first polling question. I love polling questions. It's like you're all the sperm and I'm the egg, and we're going to do this together. We're interacting. So first one up. And remember, we want your feedback. So tell us, how do you know you've started menopause? Bought a battery-powered fan for your purse? I have a lot of batteries in my purse for different things. Sprouting chin here. I've got a whole village. Sleeping naked, and not for that reason. Walked in here for something but can't remember what. Am I on a Zoom? I don't even know. So let's hear what you guys have to say. Oh, this is exciting. Here we go. Are we coming with the answers? Oh my goodness. Okay, it's up. So we've got the winner at walked in here for something but can't remember. Does everyone know where they are right now? I need to know. We've got a lot of other ones which were similar, but it looks like the forgetfulness is numero uno. How interesting. Okay, so we're all in the same boat. So we hear a lot about menopause and the symptoms. I mean, we've all heard about it all our lives. If we didn't have it yet, we've heard our mothers have it. But we need to get down to basics. I want to start with perimenopause because I feel like we don't talk about it enough. I don't even know what the peri is. Is it a fruit-based menopause? What does it mean? So let's get with Dr. Kramer. What age can we expect that to begin? Talk to us.
I'm unmuted too. And she's muted.
Hi there. Sorry about that. To start, menopause, the average age is about 51 and a half. That means not having had a period for a year. It's a clinical diagnosis. 2 to 8 years prior to menopause, a woman may experience perimenopausal symptoms. And those symptoms are due to fluctuating estrogen levels, fluctuating progesterone levels, because women are not ovulating as well or as often as they used to. And only when you ovulate do you make progesterone. And progesterone is what keeps you from bleeding too much all over the place. So sometimes in perimenopause, women can have problems with bleeding. You can start to have problems with hot flushes and night sweats. You can certainly notice hair growth that's due to progesterones and androgens, and you can have all kinds of different stress. So that's when it can happen, 2 to 8 years, and some women won't have anything. You just sort of have to see what happens. And it is interesting what you said, that I think that we are maybe the first real generation of women talking about menopause, because I think a lot of our mothers just didn't talk about stuff like that. And so when I talk to patients in the office and I say, well, how old was your mother? Most people have no idea. Either they had a hysterectomy or their moms just didn't talk about it. So it's so nice that we're all talking about our health and good ways to get through these changes.
Yeah, I mean, I just remember my mom saying she was getting hot in certain cases, but that was about it. We all had to roll down the windows when we used to roll down windows. I said it, I'm old. And, she was too hot and we were all freezing. We're like, oh, Mom, please, let's turn down the heat.
Yeah.
We didn't really talk about it. We didn't know what was going on.
That's true.
I have to say, so you mentioned this hair growth thing. I have had hair growth my entire life. Have I been in a constant state of perimenopause? What's going on?
There's a lot of reasons for hair growth, and there's a lot of reasons for all of these symptoms that can happen really at any time, which, perimenopause is really a diagnosis of exclusion. You want to make sure that there's nothing else going on. So certainly a lot of women, young women, can have what's called hirsutism, or increased hair growth. And that can happen because their ovaries aren't ovulating. Maybe they have polycystic ovarian syndrome. Their ovaries aren't ovulating. And so when the ovaries don't make eggs, they tend to make androgens, which are sort of weaker male hormones, and that can cause acne and hair growth. So it's for a little similar, but not quite the same. And same with the hot flushes. Things like thyroid disease, which are so common in women of all ages, really need to be ruled out prior to saying, yes, this is perimenopause. I do have to tell you that now that I am officially perimenopausal, and maybe in October will be menopausal, that I have found that it's not the hot flushes, but the night sweats that are just the worst. That they are the worst of everything, and it's tough. It's a hard change to go through.
Yeah, I mean, we got to go through all kinds of things, don't we? And sometimes, like you were saying, perimenopause is one thing it could be, but you could be on an IUD, for example, and have similar symptoms and no periods for a few months, but that's a different situation.
That's totally different. And IUDs, progesterone IUDs, are a great treatment for perimenopausal symptoms, for bleeding symptoms, because progesterone is how we treat perimenopause, giving progesterone. And progesterone is like the lawnmower of the uterus. It keeps the lining nice and thin so you don't have a lot of bleeding. And if you put a progesterone IUD in, some of the IUDs last 7 years, boom, you put it in, you're done. You have extremely light bleeding. It protects you against uterine cancer. It can save you a biopsy and a workup in the office. So, and it'll take you through for birth control, because remember, you need birth control until you're menopausal. You can get pregnant. It may not end up in a normal pregnancy, but you can get pregnant until you are officially menopausal.
Yeah, I learned this. Anyway, this is true. People get pregnant.
Yeah, they do. They keep us in business.
Big surprises happen in life. So are there other symptoms that we should be aware of?
Of perimenopause, yeah, some women have palpitations, but again, it's extremely important to make sure you don't have any heart issues, any underlying heart issues, because again, in middle age, this is a time when these things can show up. But certainly that mood changes. Boy, do periods become some of them can be terrible. I remember when Ebola was a thing. I remember having a dream that I had Ebola, and it turned out I was having a really bad perimenopausal period. Your nipples, it can feel like someone squeezing your nipples. The pain of all, it's brutal, and it's not every period. It's some periods and not others. And there are things you can do to treat those symptoms. Ibuprofen works really well. I used to fantasize about getting a progesterone IUD. That also works to keep your periods, less painful. Birth control pills in women who are healthy and don't have any contraindications to taking estrogen, certainly really a good treatment for hot flushes and night sweats in perimenopause, and hair growth and acne in perimenopause as well. For things like moodiness, which can happen as well, we don't really, the treatment is to make sure you don't have a mood disorder, to treat that as you would any other mood disorder. Estrogen and progesterone really haven't been found to be useful in that mode. And so many things can cause that too, being middle-aged at the same time and having teenage kids perhaps, which can certainly make you moody. Having elderly parents who depend on you can certainly make your life stressful. Having now been married maybe to the same person for 20 or 30 years can really make you depressed. Yeah, so lots of reasons for that.
Pandemic with the ones you love can really put you.
That's right.
So you mentioned things to sort of prepare for menopause. What can we do? We can take birth control, which is good to know. We can, also I think you said, did you say, what are the importance of regular checkups and screening?
Yeah, absolutely. It's so important. Pap smears are extremely important to prevent cervical cancer. They're very important. Colonoscopy, the new age of screening, is 45 now for women. It used to be 50, but it's 45. So important. Colonoscopies can save your life. Mammogram every 12 months, starting at 40, unless you have a family history. Those are so important. But the biggest thing, the biggest killer of women in menopause is heart disease. And you can add up all the cancers, and heart disease still kills more women than all cancers combined. And so what's so important from the age that you can remember is to eat healthy, exercise daily. That will take care of your bones, which start really at 30. Everybody starts going downhill. 30 is the peak of everything. And then, even though I don't know about you, I feel mentally much better than I did when I was 30. But the body, 30 is the peak. So it's so important to make sure you're eating foods rich in calcium and vitamin D. Wild salmon. If you love sardines and anchovies, they are so good for you, for your bones. So that's really important. Bone health, heart health, eating a heart healthy diet, not to get type 2 diabetes if you can help it. Try to keep your body mass index appropriate.
So is real, keeping yourself healthy. And I actually wanted to ask Dr. McCleary a quick question. I didn't see this in the symptoms. What about the weight gain? I think we're going to talk about that a little bit later, but is that something that, is a symptom of it? We'll cover that first and then we'll get more into it later, but is that a symptom?
Well, I think just like Rachel's saying, you really want to go into menopause and perimenopause at a healthy weight, again, with a good healthy diet, exercising with some kind of exercise that you like. There's probably an exercise out there for everybody, even though people don't believe it. Walking is really okay, some exercise. So you really want to go into menopause healthy, doing all the things that you should be doing. But when you do go into menopause, I mean, there is that pooch that can happen, and it is because of a transfer of the balance of the hormones. Your balance of hormones goes out of whack. So then we start to gain weight in a different way than we did when we had estrogen. So when we don't have estrogen anymore, the weight distributes differently in our body. So when we gain weight, we used to gain weight kind of all over, more in our breasts, more of in our butt and our hips, because that's womanly and, you know, voluptuous and where we're supposed to gain weight when we're in childbearing ages, because that's, you know, if we ever had to, when we're nursing babies and things like that, if we were going to starve, you know, we wouldn't have excess to feed the babies, basically, is how it works with estrogen and progesterone. When you lose your estrogen and progesterone, then your balance is off. And then we start gaining weight more like men. You know, we gain it all in their men. If you notice how men gain weight, they gain weight in their like the saddle, like hip area, saddle, whatever that thing is over here in their hip.
Menopause, is that
Muffin top.
Yeah,
Muffin
yeah.
top.
Muffin top. Oh, thank you. I knew I couldn't come up with the word. That muffin top area and their bellies first. You know, like that's where men gain weight, and they usually have these scrawny little legs and no butt. So if you look around, you know, in the store,
That's what makes us depressed.
Yeah, I know. So when you look around the store at little older ladies, you know, because we're not old, you know.
No.
So when you look at the older ladies, they tend to have no butt, no hips, and a belly, but thinner legs and arms. And so when we're transitioning in this phase, we do tend to gain weight in that belly area, which makes sense. But it really is that transition and the difference in the hormones. And estrogen is responsible for us to burn that belly fat there.
So getting back to the whole idea of how to prepare, when we say to do all these good healthy lifestyle changes, are we talking like can we start at 38, or do we have to start like, how early do we have to start this?
Probably best to start elementary school.
Yeah, I'm thinking forever, like puberty. I don't know. Well, in reality, and it sounds like it's really hard to do.
Yeah.
And it is really because, you know, you're in between. We're a lot of in between ages. Our parents are living older. We tend to have kids later. So we're the one that being like pulled in two directions, and we don't worry about ourselves. But if we're not good, everybody's not good.
Yeah.
And if we don't teach our children to eat right and exercise, where's that going to be in a few years?
Absolutely. And in fact, when you're pregnant, what you eat, how much weight you gain, determines the weight of your baby. If your baby's going to be obese in adolescence, there are real studies that show that. Yeah, really important. So a lot depends on us, on women. Yeah,
everything's on women.
I know. So unfair.
Your male partner, if that's what you have, can just eat whatever he wants while you're pregnant, and you have, my goodness, and you're eating for two. It doesn't seem fair.
No,
well, okay. So we talked about, so we know we can try to prepare for it to minimize the symptoms. Some of us don't even get symptoms. Woohoo for those people, but many of us will. And so, Dr. Graber, how do we cope with stuff like you mentioned, the night sweats and things? How do you cope with it?
Well, if you're perimenopausal, you could go on a birth control pill. Giving yourself low dose estrogen will estrogen is how you treat the vasomotor symptoms. And when you're perimenopausal, you don't use hormone replacement therapy because you're still ovulating here and there. And if you go, a hormone replacement therapy is really a lower dose, and you'll end up having irregular bleeding. So, or if you're close to menopause, you can go ahead and start hormones. I just put that combi patch right on me, and I never looked back. You read about how, and I've been telling women for years, well, know your triggers, right? But the triggers can be like a hot bath, a glass of wine, the joys of life, stress. Who doesn't have stress? So what am I supposed to do? Not have triggers? So I like a hot bath at night. So I decided that I would go on the hormone replacement therapy, the combi patch, which is just a patch that I put on twice a week. It has estrogen and progesterone, both plant derived. And because I'm very close to menopause, I'm fine. And it treats my vasomotor symptoms. So you can do something like that. Patch is, I think, preferable to a pill because estrogen increases the risk of blood clot and stroke, but if you use a patch, the risk of blood clot is much decreased than a pill. So that's why I went for the patch. I have a uterus, so that's why I do estrogen plus progesterone. If I'd had a hysterectomy, I would just go with the estrogen alone, because you don't need the progesterone is only to protect the uterus, because estrogen unopposed on a uterus can cause uterine cancer. I will say that estrogen alone does not cause breast cancer. Doesn't. That's a big misnomer. In fact, that's been proven. That was proven in the Women's Health Initiative, that it was the progesterone component that did, and it was specifically, the only thing that was studied was Provera. So what I know Dr. McCleary and I both use is not Provera. So that there is an unknown risk, because there will never be studies. But in Europe, they use it all the time, and everything is fine. There's no increase. If hormone replacement therapy isn't for you, or you have a contraindication to using estrogen, there are medications, there are certain antidepressants that can be used, like Effexor or Paxil. There are things like Catapress, which is a patch, an antihypertensive patch that works at the level of the hypothalamus, which is in the brain, which is sort of the thermostat of the brain. And so they think maybe that's how that could help. You could try over-the-counter, things like Remifemin, Black Cohosh, although, they don't have as good a track record, it doesn't help quite as many women, but you can certainly try all different sorts of things.
Talk to your doctor and figure out what's right for you. I guess.
Absolutely.
I wanted to ask Dr. McCleary, I mentioned in the beginning, I'll be honest, I didn't know what the heck I was saying, but what are bioidentical hormone replacement? What is that as an option?
Okay. So for me, I do Exuberin at Virtua, which is a name. It's really the bioidentical hormone replacement therapy. But again, just like what Dr. Kramer's on, a lot of hormone replacement therapy is considered bioidentical. It just has to look like our hormone. A lot of plant-based estrogens are out there in different forms. But what I do mostly is compounded hormones, which are compounded creams and the pellet therapy. What I do is more often, I do estrogen and testosterone, and also, because yes, we need testosterone just like men, and men have estrogen, which a lot of people don't realize that they actually need estrogen as well. It's just in different amounts, because we need testosterone too, but just not at the same amount as men. So the compounded stuff, the compounded creams and pellets, are usually for people who, either want it that way because it's a different delivery system, or sometimes they actually fail the other things, meaning like they just don't do well on the lower doses that we can give in a patch or a pill, or there's a lot of things, sprays and gels and other things that you can get from a pharmacy. But I do use the prometrium, which is the progesterone that Dr. Kramer was talking about, because you actually can't use progesterone in that way. You have to, and that is bioidentical. The prometrium is a bioidentical progesterone. So that's what I do for the women that, either want to have it that way, or really is for people who fail the other treatments, actually. Testosterone for women, actually, pellets and creams are probably the best way to do, because there's mostly only stuff out there for men. Okay.
So I just wanted to ask, is there a point where it's too late to get hormone replacement therapy? Or say you're done, you went through the menopause, is it too late? Can you start taking it later? Can that help get rid of the belly fat? Or do you have to start right away?
There's definitely a time. Studies clearly show that if you wait more than 7 years after not having had a period, your risks of heart disease, of heart attack and stroke and blood clot go way up. So it is, because this is the deal. Estrogen is a vasodilator. It's really good for blood vessels. It's cardioprotective. But if you've been without it for almost a decade, your blood vessels are building up those plaques. And what happens is estrogen then destabilizes those plaques and increases your risk. So if you are going to do hormone replacement therapy or bioidentical therapy, you really need to get on it. And to be quite honest with you, you're not going to have no symptoms and then all of a sudden 10 years later have terrible symptoms. Usually symptoms will start with, perimenopause or, in the menopause. Now, how long they go, who knows? We used to tell people, oh, it's just a year or two, but we had no evidence. Looks like it can be more than a year or two. It may be 7 or 10 years for a lot of women. Yeah, that's exactly right. We don't know. There's really a lack of studies that medicine has a lot to catch up with for women, for sure.
I mean, you don't even hear about women and having much in the way of heart disease. That's sort of like, we always think of that as a hardworking man's thing, and women don't even know how to identify it. So
absolutely,
there are some things that aside from age, is there something like, can a hysterectomy just throw you into menopause?
Depends. It depends if they took your ovaries out or not, and what your age is. So if
the side effects, is it the same?
Right. Well, it's somehow if they take your ovaries, depending, and again, it doesn't matter what age you are. If they take your ovaries, if you're younger, you will go into menopause pretty much immediately. If they don't take your ovaries, it sometimes probably throws you into menopause a little bit sooner, don't you think, Dr. Kramer?
Yes, absolutely. Because you're decreasing the blood supply to the ovaries. There's a lot of surgery around the ovaries when you're having a hysterectomy. Absolutely. It used to be, and ovaries do a lot more than what we know too, because it used to be when I was younger, I was always trained that if you did a hysterectomy on someone in their 40s, you just take the ovaries because ovarian cancer, you don't want any. Yep. However, they found that you increase a woman's mortality. You actually decrease her lifespan by as much as 10 years by taking ovaries for no reason. So nobody should have their ovaries taken for no reason. Nobody. Yeah. Now that we know that ovarian cancer, really the pre-lesion comes on that tube, we take the tubes. So we take the fallopian tubes to prevent the ovarian cancer, now that we know that's where that comes from, and we leave the ovaries. That is so important for women to know.
Right. Okay. Yeah. Don't let anybody take them from you if you're having.
You hold on to those ovaries.
Yeah.
With both hands.
Ovaries, you're not going anywhere.
Don't go anywhere.
Stay. Oh my gosh, we have so many questions and we have so much to talk about. It's hard to manage it all. There's a lot of IUDs, and if you've one question, a woman who's never had any kids using an IUD can get premenopausal around 49. Do IUDs play any part, I guess, of this?
Other than treating bleeding symptoms, they don't. IUDs can't cause perimenopause or menopause. Your age of menopause is genetically decided for you when you were a fetus. It is whatever age that is, and it's a little bit genetic. Although things can change it. If you're a smoker, you're going earlier. If you're left-handed, you're going a little earlier, apparently. Don't know why. But so there's all kinds of, but hormones will hide the fact that you're menopausal or perimenopausal, and it's okay. That's okay. So for women who maybe are earlier, like who maybe go through the change in their 40s, you know what I mean? And if they're on the birth control pill for other reasons and they just continue on that pill, it's okay. It's all okay.
As long as they feel well. I mean, as long as they're feeling well and they're in the 40s on their pill and it's helping them with their menopause symptoms, it's fine to be on that.
You don't have to suffer, right?
Yeah. Whatever makes them feel better at the time, as long as they feel fine.
Okay, so let's get to what the heck is the deal with hormones, menopause, and you're ready for it? Sexy sex. So what's going on with all this I've got the hormones, they're all flipping and flopping, going through menopause, and then You know, there's Charlie, and he's waiting over there eating potato chips. But
Well,
what am
I can do this one because I do it all day long. All I talk about all day long is sex, pretty much. So, which is, it's fun. You should come and hang out. It'll be
I
good for you.
wanna do
Anyway,
it.
basically, pretty much, I would say it's probably close to 100% of the women that come in to see me are talking about low desire, which is a big word, hypofunctional sexual desire disorder. You could try to say that a lot.
Mhm.
But so people come in with low desire and menopause symptoms. First, the main thing is what's going on with their vagina first, you know, because a lot of times women have low desire because they're having vaginal symptoms, meaning from the menopause. They're having dryness or painful penetrative sex because of dryness. So sometimes you just have to figure out what's going on vaginally first, because sometimes they just have painful penetrative sex, and that's why they don't, you know, they have low desire. So is the low desire just physical or organic? Meaning, like, is it just because it hurts? You know, that's a lot of times what's going on with them. It's just that it hurts. So there's a lot of ways to fix that organically. You try some simple things first. You know, it doesn't need to just be moisturized. Like, our skin gets dry and icky as we get older. We have to moisturize that. We have to moisturize down there too. All the moisturize. So we have to moisturize that as well. You can use something that if you go into CVS or go on Amazon and put moisturizers for vagina, you're going to get a ton of stuff. You could just go to, you know, ShopRite and get organic coconut oil and just use it. You don't want to put it in there, but you want to put it on the outside. And that actually helps a lot. You want to put it on every day though, but you don't want to get the smelly kind. You want just organic coconut oil.
Basic stuff.
Yeah.
So I could buy a giant, you know, go to one of those, you know, family places, get a giant coconut oil, organic, and cook with it, then rub it all over my body, get the vagina, the vulva involved, the whole thing, and I'm taking care of it.
Sliding.
I will just slide into every room, but I will look amazing and moisturized.
Correct. So it could be something as simple as that. Now, if that doesn't work, although, you know, you can continue to do that, but if that doesn't work, then we have to start thinking of estrogen, because estrogen is the reason why it starts to get dry and painful. So if we start thinking about estrogen instead, there's a lot of things you could just do vaginally that don't go into your bloodstream. And there's a lot. There's rings and things and all kinds of stuff. So there's estrogen rings, there's tablets, there's little pills.
And they're safe for women who've had breast cancer. Right. I want to say that, you know, that estrogen does not cause breast cancer, can grow it if you have it, right? But if you have breast cancer and you are having a dry vagina, you can absolutely use estrogen in your vagina. Same with uterine cancer, by the way. You wait 3 years after the treatment, the hysterectomy for the uterine cancer, and you can use vaginal estrogen as well.
It's the treatment that can cause dryness, and then for cancers or...
Well, the treatment is, because the vaginal estrogen doesn't go into the bloodstream in enough quantity, it doesn't increase your risk of anything.
Okay.
So it's very safe. Even though the packaging will say something different, you have to just open it up and throw the packaging away.
Right.
Recycle it if you can.
Oh, yeah. And so there's creams, there's all kinds of things you can put in there. Then if that doesn't work, then you need to start thinking about systemic estrogen, which would be the patch or the pellets or something like that. And then there's other things you can use too. Of course, there's tons. Then there's lasers too. You know how people can get lasers for their skin to help the collagen? We can use lasers vaginally too.
Right. That's a procedure done in the office that Virtua also does too. We have a department of sexual health with a wonderful practitioner there, and she uses the Mona Lisa and can do that as well.
So there's
vaginal check.
there's vagina, everything that you can do for it. So there's a lot of options out there.
But you definitely have to, it's a muscle. You have to use it or lose it. And you can't let it get so bad before you speak up and say something. Because once it gets so bad, it's very hard to walk it back to where you want it. So you don't want to let it get too bad.
I guess what I was thinking when we were talking about it, particularly women who stop having sex because they're in pain, they're embarrassed to say anything. They're too embarrassed to go to a doctor. So we have to all get comfortable saying these things.
And to be honest with you, if you're not comfortable enough to talk to your gynecologist about this, and you find yourself another gynecologist you can talk to, because you should always feel comfortable talking. There's enough doctors out there. You can find the right one for yourself that you feel comfortable speaking with.
Great advice. And this is kind of maybe just my own question, but with the coconut oil, let's just backtrack. What if you have a full set of pubic hair? Can you get it on? Like, how do
you want to part the lips? That's a very good question. Okay. You want to part the lips, the bigger lips, and just do it on the inside lips and like around the introitus, like the entrance to the vagina. You don't need to put it. You don't necessarily need to put it on the bigger lips where the hair is. You want to go inside.
Okay.
Yeah, and you want to get it on the side. Good question.
You both, I believe, have mentioned pellets. When I think of pellets, I think of guinea pigs. I think of hamsters. What are these pellets?
They actually do a little bit look like that. They kind of look like small grains of rice.
Okay.
And it is very interesting how they work. They look like small grains of rice. They either there's one for testosterone and one for estrogen. And some people just need the testosterone actually, and some people just need the estrogen, and most people need a little bit of both. Depending upon their symptoms, which I was getting to the low desire symptom back again. But they look like little tiny grains of rice, and they dissolve completely in your bloodstream. But we do put them underneath your skin, so that they dissolve underneath the skin. And we put them a little bit in, we put them in your butt cheek, in the fat of your butt cheek. Yeah, and right underneath the skin, there's like a little instrument that I use to put them underneath your skin. And the reason why we put them there is that there's some fat there and there's blood vessels there. So they're sitting in the fat and then they dissolve into the bloodstream. And then they are there all the time, which is why I think it works really well for vaginal dryness in particular, because the estrogen is there all the time. The patch does that too. So that's another my other favorite one is the patch, to be honest. And I talk to people when they come, I talk to them about every single possible availability, patches, pills, whatever you want. And I have people on every single different kind of hormone replacement in my practice. It just depends upon what's right for them at the time, to be honest.
It's very individualized. You know, you don't, if you're only having vaginal dryness, you probably don't need full body. You know, if you're having vasomotor symptoms, the vaginal estrogen is not going to help you. You know, so it's you know, if you have a history of a blood clot, a DVT, deep venous thrombosis, or a pulmonary embolus, estrogen is not for you. There are things like Paxil, which is FDA approved, you know, to treat vasomotor symptoms. It's an antidepressant. There's so a lot of times we'll use Effexor. There's gabapentin we use. It's a nerve drug, sort of, you know, for people who have nerve pain. But it's good for people who have problems at night because it tends to make you sleepy. So we give it to people in the evening time. You know, and you certainly can avoid triggers. There's definitely triggers that bring on, if it's hot flushes, that certainly bring that on. So all, you know, it's very individualized. And the other thing too, just to go back to the exercise and the heart healthy and everything, is that when you exercise and you eat healthy, your blood flow is going everywhere, including your clitoris and you're everywhere. And so, you know, people who do get regular exercise and they tend to be more, you know, have more interest in sex, in sexual activity. And remember, sexual activity can change, doesn't have to be always the same thing. You know, I talk to patients a lot about doing things that to excite, for excitement, because you want to look at a lot of the pathways in the brain that are new experiences have to do with, libido, it's felt. So, doing things, maybe having sex in a different place than you normally do, in a different position than you normally do. I tell a lot of patients, do some sexting, because that's sort of naughty, but just, with your partner, not with your neighbor.
Yeah, it's more mentally.
Yeah, make sure who you're sending it to.
Yeah, you don't want to get into too much trouble there. I'm not advocating for that, but definitely to spice it up a little bit definitely helps, and to put it first on that list. A lot of times we get busy and sex becomes down here. And the bottom line is to keep your relationship, no matter who it's with, healthy, and to have to have that intimacy is important, no matter how you do that intimacy. And so it's important to make that a priority and say, everybody's libido is different. Some people, feel, once a week, once a day, once a month. It doesn't matter. Whatever's normal for you is normal for you. But you and your partner decide, and then make sure you do it. Make sure that somebody is with the, takes care, and then you could even set a date, and look forward to it, and say to yourself, what would excite me? Forget about what would excite him or her, or your partner, what would excite me? And then it's so much of everything is here, and work with this and make it how you would like it. I think that's all an important part of libido as well in women.
No, that's what I do. Yeah, exactly. You have to change up the menu, and that's what I explain to them as well, because it's all about how you feel about yourself, how you feel about your partner, how you feel about the world. I mean, this pandemic has been awful for people and couples, because people weren't going out and doing the things that make them feel better, so that was a lot going on when I talked to people over this last year. It's how you feel, what's going on with your own children, what's going on with your parents. It's got a lot to do with up here. But sometimes people, need a little bit of help with orgasm and things like that. Some people have low orgasm potential, which again, there's another thing here for sure. I use the pelvic PT people, physical therapy people, a lot, because if things are not tighter down there, then you actually have problems with the orgasm. If it's too tight, you also have problems, because then that interferes with penetrative sex too. So there's a lot of things that are going on down there all the time. That's so right. It's just very interesting, and it's so complicated that you have to spend time with the patients. The other thing too that's interesting with couples, which leads off of what you were saying, like I think you need to also, if you've been with someone for a really long time, like see them in a different light. Like go and
see them.
Red light. No, see them do something different as a couple, so that you go, oh, I forgot I liked you, because you see them doing something else, and you can't do this right now, but I would, take a cooking class, or do something else different that you see them differently. Is a lot. And I think sometimes our partners, depending upon our partners, they don't realize that foreplay starts way a long time before the event. It's foreplay is like, you did the dishes. Oh, that was nice. You picked your socks up off the floor. Things that you picked up the kids without me asking you, or whatever it is. You washed my car.
I'm getting excited.
You're getting excited, right? Something that's so simple to us. And if we have communication with each other, and if we actually ask for what we want, we might get it. Yeah. Because our partners actually want to please us, and we just don't realize that we actually have the power.
Yeah, that's so true. And just to piggyback on that too, with the pelvic physical therapy, which really works, is that there's estrogen receptors everywhere. So when we lose our estrogen, it's devastating to our bodies. The bladder is
yeah.
really dependent on estrogen.
Yeah,
So
I
a
shouldn't
lot
do
of
that.
us, a lot of us have lower bladders, from childbirth, all kinds of things. And so, the vaginal estrogen will help with that, keep everything strong. So will pelvic physical therapy. And that's really important too for bladder health. A lot of older women who have repetitive UTIs just need some vaginal estrogen to help out with that. So estrogen is it's important for your skin, for skin integrity and hair and so many things. So that's why we notice all the changes that we notice.
Okay.
All right.
Amazing stuff. Before I move on, I just wanted to say for women, I think when we have low sex drive or, we're made to feel like something's wrong with us, but it's, when we say
men have it too, men get it too, right?
Yeah,
so I mean, like when you have, that's why a 40-year-old, they always say a 40-year-old woman should date a 20-year-old man, right? Because the libido of a 40-year-old woman's high, a 20-year-old man is high, but men decrease too, for sure. They have all kinds of problems, getting erections. Of course, there's Viagra and the like for them. And that is something you have to live with, and game changing and for a lot of people. And I think people should also remember too, there's so many ways to be intimate with your partner that don't necessarily involve penis in the vagina sex or something, something like, so that as we all age and things change for all of us, there's so many ways that you can remain intimate with your partner and feel like you are normal, because everybody's normal, right? Everybody is and everybody isn't, right?
Yeah. Absolutely. I love this.
Right.
So,
And go ahead. Sorry.
No, finish up. Tell us what were you going to say.
I was going to say the problem is sometimes I think the person with the lower desires made to think that they're not the normal one versus the higher desires. So sometimes it's more desire discrepancy. More so than this person has low desire. Right. It's just that this person has a bigger desire.
Different strengths, different folks.
Go ahead.
All different. Yeah. It's fine. You figure it out.
Yeah, exactly. So
you have to talk about it and figure
communication in the end.
Biggie. Nobody likes to communicate.
No, they just need, And you might have been with this person for 25 years and you're still not communicating, at least when it has to do with sexual things. It's really difficult.
Yes, it is. It is hard, but we have to push through it, text it out if it helps,
Exactly. Write it down in a little letter.
Post it. I don't know. Put it on a grocery list and interesting. So what are our top tips here? What are, when we talked about libido a lot, I think we could do a whole thing on libido, actually.
We could probably do a whole thing on libido, just that alone.
But overall, what are some other treatment options for menopause and post-menopause symptoms? What are our top tips?
Oh my gosh.
I think the top tips remain, to keep your heart healthy, to keep yourself in good physical shape, to exercise. Your heart is a pump that's what keeps you alive. You got to take care of it. That means you eat, lots of salmon. You can't eat enough wild salmon for your bones, for your heart. It has so much alpha, omega fatty acids in it. It's good for your brain. It's just good in general. Vegetables and fruits of all colors. So important. Get that heart pumping into the 140s, 150s, for 30 minutes if you can every day, if not, 5 times a week. Lifting weights is good. It doesn't have to be heavy, that you're not trying to be Arnold Schwarzenegger, but a little bit of like a couple pound weights is fine. Repetitive weights to tone. That way your muscle can protect your bone. That's so important. And I think, the communication, find yourself a great doctor that you feel comfortable with, that you can talk to, so that you can make sure you bring everything up. Get your screening test, get your colonoscopy. It's not a big deal. It is. When I woke up, if they told me I hadn't had it, I would have believed them. It doesn't hurt. You don't remember anything. It's all over. And then you can go have a really nice brunch afterward. You get your mammogram every year. It's so important. If you feel a lump in your breast, you go right to your doctor. You have bleeding in your menopausal, it's pink, it's brown, it's a little bit, it's just like a period. It doesn't matter. It's not okay. You go right to your doctor. All these things can really save your life. It's so, so important for women who sometimes we tend to write things off, or we're taking care of other people and we sort of push it away. Don't push it away. Put yourself up there with everybody else in your family, and make sure you stay on top of all of those things.
Mm-hmm. Dr. McClure, do you have anything to add before I guess we're about ready to hit up the Q&As.
I have no idea what time it is, but I could talk forever. So I agree with all that. And I would say, I think my thing that I see all the time, I feel like people wait for treatment when it comes to menopause. And again, I think that, or the menopause symptoms. And I think that, when you have them, don't just shoo them away. If you really feel like you're having things happening to you, go see someone about it, whether it's hot flushes or night sweats, and especially vaginal pain, dryness, because it is way easier to treat early than later. And then if you wait too long, again, because I agree 100% with Dr. Kramer, if it's 7 to 10 years later, I can't help you. You really need to do it earlier to protect your heart, your bones, your brain. We didn't really talk a lot about brain fog, but the brain fog is there. That is real. That question where that everybody can't remember what they went to the room for. They have to go back in a couple times. You feel like the dog, the dog walks in the room, the dog walks out and just keeps doing it. To protect all those things, I think that if you are having symptoms and things, go see someone. They might say, you don't need to do anything, but if you don't talk to your gynecologist about your symptoms, we can't help you if you're not coming soon enough. I see a lot of people coming, in their 60s, and I say to them, well, how long have you been having symptoms? Like 15 years. I'm like, okay, well, that isn't good.
Yeah, and I think don't let yourself get put off either. A lot of times there are definitely physicians out there who will say, oh, that's okay, that's all right. If it's bothering you, if it's something you want to do something about, then you should get treatment for it. Then you should seek treatment for it. So if the person that you're seeing is sort of blowing you off and saying, that's life, and you're not happy with that answer, then you find somebody with a different answer.
Yeah, because I always say we don't have to be in pain, but we do have to start early and start taking care of ourselves early on. And, we have these questions, and some of them are, women who are already in the throes of it. And it's, it's like, I wish, we should have been told in a sense before.
No, and I have had a lot that a patient will come into me and they're like, oh, my doctor said it would just go away.
Oh,
and I'm like, that's terrible.
No, I guess is that when it's over, when menopause is over, is that what they're saying? Well, it's going to go away. It's going to end. And then that's when
menopause is forever.
Menopause is forever over.
Yeah.
It's not over until we're dead. That's it.
Yep.
It's the last
pushing up daisies. When we're pushing up daisies, it's done.
Well, we do have a bunch of questions, so I'm going to ask the first one. Question 1, if I'm about 1 to 2 years into full menopause, can I still do something to help? And we've kind of talked about this, and is it too late? But is it only 1 to 2 years?
Not too late.
Yes.
Not too late.
Not too late. Come on down.
Talk to someone, and then talk to someone who wants to help. That's what we're looking, right?
Because there are physicians out there who don't know, who may not be aware of answers, and those tend to be the physicians that put you off. I mean, if someone doesn't know, they should be able to refer you to somebody who does.
Mm-hmm. Yeah. Can you mention a few over-the-counter brands of estrogen or creams, please?
Well, there's no over-the-counter estrogens, because estrogen is a prescribed medication. I will tell you, Astroglide you can find that at any CVS. It was made by NASA. I'm not sure what for, but that's why it is called Astroglide. And that works very well as a non-hormonal lubricant that you can put on the inside for intercourse. Mm-hmm. There's Replens that you can use on the inside as well too, just for if you have just dryness in general. When it comes to vaginal estrogens, There's a ring. I think the ring is the Cadillac version. The ring is the Cadillac because you put it in and it's in for 3 months. It gives you a steady dose of estrogen. You don't have dips and it's not as messy as, say, the creams. And that works really nice. You can have sex with it in. I mean, you could take it out if you wanted to for sex, but you really don't need to. Then there's the pill that you put in twice a week. Of course, there's ups and downs with the pill. And then there's the cream, which is just for it's just messy.
Yeah.
So there's so many things. You can put things outside and apparently in your butt skin and put things in there. And this ring you can put in and out. You can actually.
Yes, it's called the S-string.
Yeah.
Okay.
My favorite 2 lubes actually are Good Clean Love, which is a water soluble lube like the Astroglide. Which water soluble lubes are better for like toys and things like that. You want to make sure that you use a water soluble one because the silicone would break down in the toys if you don't use a water soluble. And Uber Lube. Uber Lube is a vitamin E and silicone based lube, which is more stickier to your tissues, so it will last longer. That one you have to buy on online actually, or Amazon.
So many different.
There's lots of different. Go ahead. Sorry.
So next question is, what's the reason for joint pain during menopause, and how do you treat it? Is that a thing?
Usually estrogen has something to do with that. Actually, I find.
Your
Because
joint.
yeah, usually estrogen. I mean, you could have osteoarthritis, of course, too, but I do find my patients when their estrogen is better, usually their joints feel better. Interestingly enough.
Okay, very interesting. Let's keep going. Does CBD cream or suppositories, those are the things that you put in there, right, help with vaginal dryness and or sexual response, desire? So does the CBD is such a thing now? Is that something that will help with your dryness, your desires?
I have not known that to happen.
No, Dr. Cream?
I don't, I don't know if, I mean, if any kind of suppository that is put into like a glycerin, so I don't know what the CBD would be in, probably could have dryness as a moisturizer, would be my guess. So I don't know that the CBD would have anything to do with it, but I don't know. I would have to look that up or look at it. Do you know, Rachel? No?
I don't know.
I mean, but that would be my thought, is that if it's in some kind of a glycerin base as a suppository, it probably would help moisturize it a little bit.
Yeah.
I guess,
So it could be a placebo. Is what
okay. Oh, interesting. All right, moving along. Another IUD question. What if you have an IUD, this person had theirs for 4 years, and are having sweats, hot flushes? Is that normal?
Yeah, because a progesterone IUD is not, well, first of all, progesterone doesn't really treat hot flushes. It's the estrogen, but the hormone in the IUD theoretically only goes to the uterus. There might be a small amount that goes into the bloodstream. So, when you have a patient who has symptoms of bleeding, a progesterone IUD is great, or, painful periods, it's great. However, if you have vasomotor symptoms, it would be a birth control pill would be much better way to treat that. Or if they're menopausal, HRT or bioidentical, it would be the way to go, and that would be the best way.
Okay.
Yeah. So she could be, depending on her age, she can be either perimenopausal.
Maybe she's just going through the change.
Right.
Right. You're right.
Yeah, that would be my guess.
Yeah.
Okay. Some boob issues have popped up, I noticed.
Good.
Popped up literally here. Hello.
Yeah, that's what I was thinking.
If I have breast issues and my specialist does not recommend hormone therapy, what else can I do for all the symptoms I'm having? Brain fog, hot flashes, mood swings, lack of sleep, so many.
Yeah. Well, there's a lot. It was all those things that Dr. Kramer already mentioned. Like there's definitely other things like the cataprest patches, estrogen, other things like that.
Gabapentin, maybe, Paxil, Effexor. There, you can try all of that. You can just run through the list. A very good website is menopause.org. Menopause.org is the website for the North American Menopause Society, and it's not a bunch of drug reps selling their stuff. It's not somebody in their basement in Minnesota. It's actually, a really good, a very good website with doctors and scientists. And it really has a patient portal, which is very nice, that can take you through everything. So I often tell my patients, you go look at menopause.org, try some of the over-the-counter remedies if you want. Look and see what the options are. Read it. See if anything rings your bell. If anything really, seems to stand out to you. And then, you can try the different things and see if something works that's not hormones. And then, of course, there's hormones if that works, or if that's something that you can do.
So for her, it's just going to depend. It depends like what her symptoms are. Like we'd have to go through each symptom and like, so she needs to talk to somebody that's a menopause practitioner, basically.
Again, you got to talk about it, right?
Right. And we'd have to like curtail it to her, depending on what it is. And she would probably have to try quite a few things to figure out what would work for her.
Yeah, I mean, and there's so many different things, right? Like there's a question about like calcium recommendations. Are pills or liquid better? Like it's, those types of things.
I'm going to be honest with you. Studies really show, you definitely should take, you have to take your vitamins, but I have to tell you, eating your minerals is the best way to get them. So they've done lots of studies looking at folic acid, looking at so many different things, and people who eat, because we're animals, so our gut will absorb more of the calcium when you eat it in a salmon fillet or in a green leafy vegetable. But when you take the pill, we're only absorbing a small percentage. The rest is in the toilet. So you remember when you take your prenatal vitamins, your urine changed a different color, or sometimes if you take any vitamins, it's because most of them are you don't absorb. So so I'm not saying you shouldn't take vitamins. You can do that, but you should not rely totally on that. I always tell patients, Google foods high in calcium, print it out, hang it on your refrigerator, and every meal you have, because you'd be surprised how many things have calcium in it. Tofu, cumin, I mean, all kinds of crazy stuff. And put it in your meals throughout the day. Nutritionists will tell you if you take small amounts throughout the day, that's the best way to absorb your minerals. So that's important. Vitamin D is hard because there's not a lot of foods that have it. Shiitake mushrooms, you should put shiitake mushrooms in everything. They are very high in vitamin D. And of course, sunlight, but everyone, with skin cancer and everything, that's a problem. So, but wild salmon sure has some vitamin D in it and no mercury. So, again, anchovies and sardines, all very, very high in calcium and vitamin D.
Yeah, it's good to know, you think it's just one thing, but I'm a fan of cumin. So I'm going to think about that in my... We have one last question. We're here. We've come to it's like our menopause is ending with this one last very good question, actually. I love this question. So I'm very curious to see what you'll say. What if you've been through menopause for about 2 years and you haven't had any real symptoms? Does this mean you will never get symptoms? Are you just lucky? And can we watch this person?
You're lucky every day you wake up and you're alive. That's what I say, that every day you wake up is a great day. Sure, if you don't have symptoms, good for you. That's wonderful. Keep it up, good genes will get you further than most anything else in life. So that's really, really good. Usually, and it's a generality because everybody's different, but in general, if you're, 3 to 4 or 5 years out from your blast period, you're not going to start up with symptoms. So when women come in who have symptoms that start up late, that's a sign you really have to look at other things. That's really, really important. And again, I just want to end with this too, that even when you're the appropriate age, you really want to make sure that other things aren't going on. I had a patient come to me and she talked about having early satiety, which means she was full fast. And that's not a usual sign of menopause, but I certainly wouldn't say to her, it can't be. But I told her, you need to get that checked out, because that, as a doctor, when someone says that's a scary symptom, actually. Turned out she had lymphoma. So, You know, you don't want to, I'm not saying, oh my gosh, you should be scared, you know, all of your stuff, but you really want to make sure, because there's so many other things that can cause a lot of these symptoms,
Right.
that you check everything out. You get your thyroid checked, you go for your regular screens, you get your heart checked out, you know, and then if it all is good and checks out normally, then you can say, okay, this is my perimenopause, my menopausal symptom.
Right. I agree.
I mean, what a great way to end it. There's hope for some people, and it could be good.
Oh, absolutely. There's hope, for sure.
Wonderful. So those are all of our questions. And we want to thank you both, Dr. McCleary and Dr. Kramer, for not only answering these questions, but making us feel more assured and good about it, and making me definitely want to talk to my doctor and talk to everyone I know. I'm going to walk down the street and just talk about menopause. I'm going to tell the world if I don't feel very good. I'm going to let them know and see what happens. That's it for tonight. We loved all the questions from the audience. This was such a fun time. Thank you so much. And this was wonderfully helpful.
Thank you so much, Madge. It was great talking to you.
Thank you. Thank you
Thanks,
so much.
Rachel. Good night.
Okay, so thanks for joining us. I learned about my menopause journey, and I hope you did too. And thank you to the doctors, as I said. Another terrific and honest Real Talk session. Virtua Health, what a great organization to put together this event, and I'm so happy to be a part of it. Ladies, make sure you connect with them for whatever your healthcare needs are.